The College of Health Sciences and Professions at Ohio University offers a master's degree in physician assistant practice at the Dublin Integrated Education Center in Dublin, Ohio. The mission of the Ohio University Master of Physician Assistant Practice program is to prepare students to be leaders in PA practice in any clinical setting, with a particular emphasis on primary care in urban and rural underserved communities in the state of Ohio and throughout Appalachia, using an interprofessional team approach. We strive to teach this mission throughout our curriculum and practice it during the clinical year. Our mission prepares students to be leaders in their fields, and it's our hope that our graduates will go on to practice medicine in underserved communities around the state and around the country. We are seeking applicants who are fully committed to our mission. In 2019, the ARC-PA granted our program the status of accreditation continued for 10 years. This status means that we are in compliance with accreditation standards and offer a quality education to students. Additional information about the program's accreditation history can be viewed on the program's website and the ARC-PA website. Our program's greatest strength is our faculty and staff. We are proud to have a diverse and interdisciplinary faculty representing PAs, physicians, a registered dietitian, and a licensed pharmacist in our program. Collectively, the faculty have experiences in emergency medicine, family medicine, pediatrics, women's health, public health, endocrinology, geriatrics, surgery, orthopedics, and research. Our administrative staff is comprised of higher education professionals that have held various roles in student services. Together, we are committed to achieving our program's goals. Ohio's PA program begins annually in January and concludes 27 months later with graduation in May. The program's curriculum is delivered over 7 semesters that are designed around 7 distinct core series, such as professional development, foundational sciences, clinical nutrition, clinical skills, clinical medicine, clinical practice, and research. The series are fast-paced and systems-based, allowing the assessment, diagnosis, and treatment to be taught within the same academic semester, while concurrently integrating evidence-based medicine throughout the curriculum. And to reinforce our mission throughout the curriculum, multiple classes cover issues such as access to healthcare, social determinants of healthcare, and cultural differences in healthcare. The didactic phase consists of the first 4 semesters in the program. Classes are scheduled Monday through Fridays from 8 to 5 at the Dublin campus. The final semester of didactic training is designed to transition students from the classroom to the clinical setting. Problem-based learning, scenarios, case studies, and simulations are integrated in order to prepare students for the clinical setting. Ohio's PA program is extremely rigorous, therefore students are encouraged to focus on academics. Thus, employment during the program is strongly discouraged. All candidates should consider acceptance to the program as a 27-month full-time commitment. Ohio's PA program state-of-the-art facilities are housed in Dublin at the Integrated Education Center. Throughout the curriculum, students utilize technologies in various lab settings in order to simulate real-life patient interactions and an enhanced learning experience. Our technologies include, but are not limited to, 4 types of human patient simulators, 8 standardized patient rooms, training models such as intubation, pelvic exam, breast exam, and prostate exam models. IV trainers and lumbar puncture models are also available to students, and we conduct on-site suture and scrub labs. During the didactic phase, we also offer interprofessional learning opportunities such as nursing home visits to take H&Ps, ride-alongs with local EMS crews, and opportunities to work alongside of providers in the ED. We are also proud to say that we have a full dissection cadaver lab on campus with a 4-to-1 student to cadaver ratio. Students utilize this space in the first semester during the clinical gross anatomy course. By offering access to such technologies and facilities, training models, and interprofessional experiences, we create well-rounded simulated clinical experiences on campus, coupled with real patient exposure opportunities in the community. The clinical phase of the program consists of 3 semesters of supervised clinical rotations and 7 required clinical specialties and 3 electives. Ohio's PA program's clinical rotations consist of both in-state and out-of-state experiences. Students are responsible for all rotation-related expenses such as travel, housing, and food. In keeping with our mission, students complete a portion of their clinical training in medically underserved areas. In addition to the clinical specialties, students experience rotation in large medical centers, small urban and rural clinics and specialty clinics, and will learn how to function in interprofessional healthcare teams while on rotation. Rotations are identified, contacted, evaluated, and assigned by the program. Students are not required to provide or solicit clinical sites or preceptors. At the end of the clinical phase, students are required to complete a graduate project and pass critical assessments as partial fulfillment of degree requirements. After graduation, students are eligible to sit for the PANCE certification exam. For updated cohort PANCE results, please see the About tab on the program's website. At Ohio University's PA program, we integrate resources that help students thrive in and out of the classroom. Our student-centered policies regarding remediation, course failures, leave of absence, student grievances, and deceleration can be found on our website under Student Resources. Each student is assigned a faculty advisor while in the program. Faculty advisors offer students individualized academic and personal support plans in order to promote academic growth, increase self-awareness, and cultivation of leadership skills while in the program. Incoming students are also assigned a peer mentor to help in the transition to PA school. Peer mentorship is an important relationship that helps to enhance a student's educational experience in the program. Students also benefit from access to services in Athens, such as counseling and psychological services, student accessibility services, and services in the Career and Leadership Development Center. Lastly, Ohio University requires all students to have health insurance when enrolled in more than 7 credit hours. Since PA students are full-time graduate students, they are eligible to purchase health insurance through the university if needed. It's not all business around here. Our students are encouraged to get involved and have some fun. Students can run for seats in the Physician Assistant Student Society of the Ohio University called PASOU. This is the student government, and the nominated class president also serves as the PASOU president. PASOU organizes many events on campus, such as PA Week, canned food drives, No Shave November, and an annual 5K. PASOU also organizes community service and outreach events in the greater community for the cohorts. Ohio PA students are also able to join some of the osteopathic medical student groups, such as the family practice or emergency medicine clubs. This is a great chance for PA and medical students to collaborate early in their education. Service to the PA profession beyond what the university has to offer is encouraged. Therefore, all students join AAPA and OAPA in their first semester of PA school. Getting involved in student government, professional organizations, and student-led clubs are great ways for students to represent our mission while on campus. Admission to Ohio's PA program is highly competitive. We receive over 300 applications per year and can admit a cohort of up to 45 students. The following information will contain detailed overview of our admissions process, as well as the types of candidates we are seeking. In order to apply to Ohio's PA program, all applicants must meet the following standards of admission. Candidates must have a bachelor's degree from a regionally accredited U.S. institution. Candidates may apply if a bachelor's degree is completed or will be conferred by matriculation. Candidates must have a CASPA calculated cumulative GPA of a 3.0. Candidates must also have a minimum math and science GPA of a 3.0. The math and science GPA is calculated using grades from the required prerequisite courses. Candidates must submit official GRE scores with the CASPA application. GRE scores are valid for 5 years within matriculation. All prerequisite coursework must be completed at a regionally accredited U.S. institution. At the time of application, a candidate can only have 2 outstanding prerequisite courses. Courses that are in progress are considered outstanding. Students are required to have healthcare experience acquired within 5 years of matriculation. No set minimum number of hours is required. Candidates must submit 2 letters of recommendation. At least 1 letter of recommendation must be from a practicing non-related PA, MD, or DO. Other documentation such as an updated CV, resume, and personal statement are also required for admission. And keeping with the mission of Ohio University's PA program, the admissions committee will give special consideration to candidates who are permanent residents of Appalachia and U.S. military members. We also give special consideration to candidates with leadership experience and community service hours. To see if you could be a competitive applicant in the future, please see the admitted applicant demographic section of our website. In preparation of application, please be advised that all of the following prereq guidelines must be met. Prerequisite coursework must be completed with the minimum grade of C. Prerequisite coursework must be completed at the pre-medical or pre-health levels. If a prerequisite course is retaken, the admissions committee will take the most recent grade into consideration. Human anatomy and human physiology must be taken within 5 years of matriculation. Medical terminology must be at least a 2 credit hours course. AP credits taken within 10 years of matriculation may be accepted if the AP credits are listed individually on your official college transcripts. Test out, placement exams, life experience, and other professional certifications are not accepted in place of prerequisite coursework. All prerequisite coursework must be completed by matriculation. As previously mentioned, applicants are required to have healthcare experience acquired within 5 years of matriculation. Healthcare experience is evaluated by the role and the number of hours performed in that role. Experiences can be full-time, part-time, or volunteer. The most common roles our applicants have reported are listed here. Many other roles are not listed here are also accepted by the program. Shadowing hours are not accepted as healthcare or patient care experience and are not considered during the application process. At the time of application, applicants must report hours that have been accrued to date. Hours that have been projected or have not yet been accrued will not be accepted. If granted an interview, applicants will be asked to provide an update of accrued hours since the time of application to the admissions committee. Application to Ohio's PA program has 3 components. Component 1 is the CASPA application. The CASPA application cycle opens in late April and the verified deadline is August 1st. Verified is the status given by CASPA when all coursework has been reviewed and accepted. Along with being verified, all parts of the application must be official and must be submitted by August 1st in order to be reviewed. Component 2 is a supplemental application. The recruitment and admissions coordinator will review all verified and completed CASPA applications between August 2nd and August 15th. Upon completion of that review, candidates who have been selected for interview will receive detailed instructions via email by the end of August on how and when to complete the supplemental application. The supplemental application requires a non-refundable fee of $50. Component 3 of the application process is the interview phase. Applicants who have been selected for interview will be notified via email in late August. Interviews facilitated in the MMI format will be conducted in September and October. Candidates will receive a conditional decision by the admissions committee within 5 business days of being interviewed. If offered conditional admission to the program, all candidates must meet technical standards, immunization verifications, criminal background checks, and toxicology screening standards for admission. These requirements are outlined in detail on our website. The cohort will be selected by mid-November and will matriculate and begin classes in January. As previously mentioned, admission to Ohio's PA program is extremely competitive. We seek candidates who are well-rounded individuals with a strong academic history, professional background, and one that exudes maturity. We believe that solid academics are the key to a student's success in our program. A strong commitment to lifelong learning is also an essential trait that we seek in potential students. In addition to having a strong academic history, we seek applicants who are experienced in healthcare and who are comfortable working within interprofessional healthcare teams. Having quality interactions with patients prior to PA school not only enhances the educational experience, but it also reaffirms an applicant's desire to pursue a career as a PA. We are seeking candidates who are mission fit and demonstrate exceptional leadership qualities. Permanent residents of Appalachia and U.S. military members are encouraged to apply. Also, candidates who demonstrate a consistent commitment to community service in underserved areas and who have held leadership positions in organizations that make a difference in the community are also given special consideration. And last, the program's rigorous curriculum is delivered at an extremely fast pace. Being a self-directed learner who demonstrates emotional intelligence, a strong sense of self-awareness, accountability, and professionalism during the application and interview processes are the applicants that typically stand out above the rest. The tuition and fees for the program are published here. The in-state and out-of-state resident fees only cover tuition and fees that are set by the university. These amounts do not cover the cost of books, supplies, room and board, transportation, technology fees, and other personal expenses that you will accrue in the program. These costs are estimated at an additional $50,000 for the program and can be seen here under other expenses. More information regarding tuition and fees and financial aid are located in the About section of the program's website. This concludes the presentation. Please visit our website for more information about Ohio University's Division of Physician Assistant Practice.